Cellped, first of all, I thank you, Cellped, for giving me a platform to share my thoughts with you. Actually, we planned into two sessions. One is a basic aiming practice, part 1 and 2. In this first part, we will only deal with what we call how to go with the basics, even management and all. Because mainly I am focusing on to the vet students and the budding vets who are into this avian practice for the first time. Sorry if somebody who is having already in avian practice, please excuse me, because I am telling from the very basic so that everybody can understand the session. Once you've been into this section only, you can able to see the my second part is actually the treatment and all the clinical techniques, how to give IV, how to give intraocular, intraosseous route, everything I will deal it with my second presentation only. Once you go through this one, you will able to find the second quite easy. I am Dr. Jinu from Kerala. So outline of my presentation includes what is the exotic birds, what are the identification methods, sexing, avian behavior, handling and transportation, physical examination, feeding and nutrition disorder. We will see one by one in details. Okay. So, the class Aves consists of different orders. You can see in my screens. Of that, today I'm only going with the encircled orders like Passeriformes, include canaries and finches, the colubiforms and psittaciforms. Psittaciforms is a order which we are more into exotic. Means most of our exotic pet patients will be from this psittaciforms orders. So one big challenge when we are into the avian practice is that whenever I am into this practice, people will come up, a new breeder or new hobbies come to you and sir, I'm a new person, because right now this one is a coming up. That's what it's a coming up industry actually, this pet bird rearing. So they will ask you what bird to be reared if I'm a first time user. So you can tell the small birds like lovebirds. Hope you can see my pointer. This is a lovebird, finches, canaries, budgerigar or parakeet. This one is a cockatiel. And if you are into experienced breeder, they can go for the bigger parrots like macaws, cockatoos. This is Amazons and grey. So I'll just rush into the photos of each and every exotic in Indian scenario, what are available in India, who are bringing this exotic birds. So first one is the most basic, for a basic breeder. You can start with the lovebirds. Lovebirds come under the genus Agapornis. Agapornis is nothing but it's from the word agape means love. Ornis means ornithology, dealing with birds. That means love birds, Agapornis. So it includes so many genus like Rochelles, fisheries, nigricans, and all those things. And these are different. They are very colorful, small birds. The good thing of this one is that these breeders, no, they will do different mutation and combinations of this. If they take one masked lovebird, they will mix it with the Rochelle, they will produce a new variety. So a good and rare color fetch more profit for them. And second one is the budgerigar or budgies, or also called as parakeet. They are also a very common exotic birds which seen in India. The good thing is that they are sexually dimorphic. That means male is having this area is called as serrae. Serrae is nothing but it is a muscular portion just around the nasal opening. That is called serrae. The serrae of the male budgies will be blue in color. The serrae of the female budgie will be brown in color during the brooding season actually. So like that we can able to differentiate whether it's a male or a female. And next one is a finches. Finches is also a very beautiful bird. Come under so many Bengali finches, zebra finches. Out of this one is a golden finches, very beautiful, and come under different color varieties. See the rainbow color, very beautiful one. The next one is canary. Canary is also, we have a lot of canary birds are there. Of that is it. Like canary is actually it's a coming up industry. It's not been much flooded in India. They all have different color varieties. And parrotlet, actually, it's like there are very few parrotlet in India. It's like very few breeders have been keeping the parrotlet. But just for your information, I'm sharing the pictures of the parrotlet. Another comes the cockatiel. This is also a small variety a beginner can go with. Some of the cockatiels, they exhibit sexual dimorphism. That means you can differentiate a male cockatiel from a female cockatiel. You can see the good thing is that this is called as cheek pouch, this orange one. The or very good orange round cheek pouch is for male, and very light cheek pouch is for female. And another beautiful bird is a conure. This is a sun conure. Different variety conures are there. This one is a sun conure, very beautiful bird. And next one is lorries and lorikeets. Okay. So many of the people usually message me, sir, what is the difference between lorries and lorikeets? We are hearing it so many times, the lorries and lorikeets. Lorries and lorikeets is basically the same only, like color varieties, all the varieties are same. Like rainbow lorries are there, rainbow lorikeets are there. But only thing is that there is a slight color difference, size difference. When compared to lorikeets, lorries are large size. This one is a lorry. You can see my pointer, hopefully. They are large in size, and you can see the tail. Tail is short tail with a square shaped tail. But when compared to lorikeet, they are small in size, but they have long pointed tail. See the long pointed tail. So next one is a cockatoo. This is called as umbrella cockatoo. So many varieties have been there. Of that, this is umbrella cockatoo. Then comes, sorry. Then comes the Eclectus parrot. This is also a very beautiful bird. You can see the male. The male will be green in color. The female will be red in color. This is also a coming up one. And African grey parrot is very common in India. And the good thing of these birds are there. So many people are keeping African grey parrot. Once they are been through 1 or 2 years, they are rearing lovebirds. They will switch to African grey parrots as well, because they are very intelligent, very talkative. They have good lifespan too. And this is the Amazon parrot. So many Amazon parrots are there. Of that, this one is a white fronted. You can see a white friend over here. It's a white fronted Amazon. And another one is a Senegal parrot. Next one is a quaker or monk parrot. This is also an coming up industry. And last but not the least, this is a macaw. Macaw is actually the highly prized bird among all the cetaceform birds. You can see different beautiful birds. Blue and gold macaws are there, scarlet macaws are there, blue throat, buffon's macaw, green winged macaw, and among that special macaw is there. That is hyacinth macaw, which is highly prized one. So why we are going for exotic birds? Why people are coming nowadays with exotic? They want to know more about exotic because of two things. What I feel personally, one is that because of their lifespan. You can see different birds I have given in this chart. See, if you have a macaw, they can live up to 100 years. At least average for 75 to 80 years, of course. So just like a human age, if you have a macaw at your childhood, it will be there till your death or your graveyard. That is the best thing of these birds. So, dog and cats, of course, we have all the pet, people are having a pet, but average age of the dog and cat is 12 to 15 years. But you see the lovebirds here, that smallest bird among this one, they have the lifespan up to 20 years almost in captivity. I can say 15 to 20 years. That is a good thing of this birds. Another good thing is that there is a Wildlife Protection Act of India, 1972. It says that we are not permitted to rear any of the native birds in India. That means we have so many native breeds like hill myna, coil. This one is a coil. This is a kite. This is a barn owl. This is jonco. This is a rose-ringed parakeet, peafowl. These all are our native wild breeds. We are not permitted to rear this. These are illegal according to this act. So somebody people bring to you with these birds, you can tell it's illegal. You have to get the consent from the what we call the Forest Authority of India for the treatment. But if somebody is bringing an Alexandrian parakeet to you, and but if it's an emergency, you have to see to it. Then you have to inform the forest department accordingly. Okay. Next one is if you want to rear an exotic, any of the exotic birds you can rear, but some of the birds like macaw, African grey parrot, Senegal parrot, Amazon parrots, and falcons, if you want to rear, you have to go for CITES certificate. CITES is nothing but Convention of International Trades in Endangered Species of Wildlife, Flora and Fauna certificate. That is CITES. These are the endangered exotics. So you have to get while importing, you have to get their certificates done. Along with the importing certificate, you need to have the health certificate, just like we are giving in dog and cat. While transporting through air and all, you have to get it. So thus we are going to the next part of my presentation. That is nothing but identification method. There are different identification methods have been prevalent. Of that, the basic and the very common one is banding. So you can see different bands are there. Rivet lock-on bands, button bands are there. But I classify these bands based on their closing and opening. That is open band and closed band. Open band is nothing but it's a cut end band. That is a temporary type of band. You can put the band into the leg of a bird and you can remove it. But there is a band called as closed band. Closed band is a permanent one. If you are putting a band on the bird, a closed band, that will be a permanent marking or a permanent identification method. But if you want to remove it, you can cut and only remove it. That means if you have a bird, closed band bird, that you can trust more. Okay, that's what. So I have given a diagram over here. So it's nothing but how to put a closed band. When I was working in Kerala, during my earlier time of my career, one person on a fine day has bought me a bird with closed band. He asked me to put the closed band. So like that, some of you might have experience. This is a way how to put a closed band in birds. You know, they have 4 digits, 3 pointed anteriorly, 1 pointed backward. So of the 3, you can take together and put the closed band up to the center. Then you have to bend the last caudally directed digits to the back and then put your closed band over here like this. Then you free that 4th digit. So like this, you have to go for the banding. This will be helpful for you. And in goose, they are going for goose collars, just for your information, not at all practiced in India. And even in this webbed birds like goose and ducks and all, they are going for web tags also. This is a web tag. This is not just for your information. And this is another important identification method as far as exotic in India is concerned right now. Just like microchipping in dogs and cats, people are coming with microchipping in this exotic birds as well. So when you have a small birds less than 5.5 kg, you can microchip at the pectoral muscles basically. And pectoral muscle is nothing but the chest muscles, okay, heel muscles. And if you have a large bird greater than 5.5 kg, you can do at the neck area. Just like we are doing in a dog or a cat, the shoulder area, neck area. And this is a cheap reader, just like dog and cat, we can read it with this. And this is another important thing. You might be, if you are going into an avian practice, you all might be coming up with this, because they will bring in 2 cockatiels or they bring 2 African lovebirds and ask me, doctor, I have bought him just like a pair. Can you say me which is a male and female? This all will confuse us. But you can say that you have to know how to sex these birds. There are different methods are there for sexing or identification the sex of a bird, like visual sexing method, behavior sexing method, anatomic sexing method, genetic sexing method, and surgical and DNA sexing method. Of this, the surgical and DNA sexing method is a 100% confirmatory method rather than other one. So when we are going for visual sexing method, depending on the size, male will be less size than that of female, normally in birds. But it's like a not a hard and fast rule. And wing spot, see, when you see this pearl variety cockatiel, you can see the adult hen, the female will be having wing spots. Adult male will be a uniform color, no spots are there. That's also only little 1 or 2 varieties we can see, not all those things. That is the limitation of this sexing method. And cheek patch, obviously I have told just when I showed the cockatiel photo, I told you that this cockatiel face and all those things, this cheek pouch, male have orange big cheek pouch, female have less colored cheek pouch. Okay, and of course I have told you about the serrae color of the budgie. You know, the male will be blue in color serrae, female having the brown colored serrae. This is a visual sexing, but only the limitation is that if you want to visual sex a bird, that have to be adult. You can't sex a small birds by this method. And another one is also behavior sexing method. That is also when a bird become adult, only you can see it, because males will be more active than females. That means to attract the females, they will make mating calls. They are more aggressive. Exceptions are there. When you compare to sulfur cockatoo, a type of cockatoo, or an eclectus parrot, in them, the females are more aggressive. So, every breeds or every species, there are exceptions, just like that. Another one is anatomic sexing method, just like poultry, we are going for by pelvic bone sexing when the female become started egg laying period. The pelvic bone will be of, because in between two pelvic bone, the width will be more when compared to male. Okay, so if you have a male and female only, you can compare it and see. And also, vein sexing method is practiced in pheasants and goose, just like poultry, common poultry or chicken. And another one is a feather sexing method. In feather sexing, there are, when you compare the wing feather of bird, there are two feathers. One is a primary feathers, and the second one is a covered feathers. Okay, primary feathers is a biggest feather, and covered feather is the penultimate feather. So if when you take the cheek, if the primary feather and covered feathers are of same size, you can say it's a female. In male, primary feather will be more size than of covered feathers. And another sexing method, which is a very limited sexing method, that sex-linked mutations are there, especially in cockatiels, pearl variety cockatiels. If you are crossing a male pearl with non-pearl female, the first F1 progeny will be, all the pearl variety will be surely a female. That is only limited to that pearl variety cockatiel, not for all. And then comes the most important sexing method and 100% confirmatory method. One is surgical sexing method, which is very limitedly practicing in India, abroad. For falcons, they are going for laparoscopic sexing method, whether to see a male or female sex organs. DNA sexing method. This is the best thing I want to uh, tell all of you about this one. This is a DNA sexing method, which is 100% and very simple method, which you can sex a bird, exotic bird. For that, three materials you can use. One will be feather, that is the best one. Other things, the blood from the bird, or eggshell from which the bird is hatched. But the limitation of this blood and eggshell is that blood you have to cut from the toenail, and it is a cheek. But the problem is that sometimes if the breeder is inexperienced person, if they cut and sometimes it keep on bleeding, you find it difficult to control the bleeding. That is a limitation. And another one is eggshell. The thing is that if there's in a clutch, there are 10 eggs in an incubator. So from which egg, which bird has it out, that will be confusing. That's what, if you are correctly identifying the eggshell from which the bird is identifying, you can send that eggshell to the lab, you can get it. So in India, there are different DNA sexing laboratories are there. Very trustworthy and very famous one are Trinity Veterinary Diagnostic in Hyderabad, Vetagenics in Bangalore, and Glorious Exotica Lab in Pune, and in Kerala, in Cochin, we have Beaks International. So the trustworthy and important one where we can rely upon. The things to be furnished along with this sexing when you are sending the materials, that name of the farm and address, ring number, type of the bird. They will charge 200 to 250. If you have more samples, they will charge very less. And when you're going for feather sexing method, if you are how to do a feather sexing, that's what for the samples for a small birds like finches. If you want to take 2 or 3 primary feathers, put it in a Ziploc cover and send it with all the address and all those things. They will can send it to the particular laboratories. And if you have going for a medium-sized birds, you can take 2 secondary flight feathers and or 1 tail feathers will be sufficient. 2 to 3. They will tell that you send 2 feathers, but for a sea side, you can send 5 or 6 feathers, not a problem. And for big birds like cockatoos and macaw, you can see the breast feathers will be or back feathers. You can take a lump of breast feather and back feather to 5 or 6 in or 10 in numbers, put it in a Ziploc cover, lock it and send it to you. That is the best one. So I personally suggest. What we call this feather sexing method. Blood sexing method, just for your information, I will let you know. That means first from the toenail you are taking the blood. You just like nail clipping. You first disinfect the toenail and dry it for 2 minutes, and there will, along with the card, usually this people will send the blood collection card also with them. Otherwise, in the blotting paper will sufficient. You cut just below in front of the nail bud, So we'll get the bleeding. So you just squeeze it, put the drop of blood directly into the what we call this blood card or a blotting paper and put in a Ziploc cover and send it. That's it. So this is a certificate actually they will provide. This is a certificate issued by Glorious Exotica Lab. It's one of my client lab conure. You can see the species ID, whatever the ID you have given, that will be there. Species name will be there. The name of your owner will be there. Farm name will be there. Received date will be there, and the same day record. And this is a result. So this one is a female. Like that certificate they will give. If you have a bird with the DNA certificate, you can 100% rely on that. Next, one important thing is that the avian behavior. Avian behavior is a little challenging. Once it's less related to animal behavior. That's why I am stressing onto the avian behavior. There are two behaviors are there. One is a normal avian behavior and abnormal behavior. If you know the normal avian behavior, then only you could able to see what is abnormal. Normal avian behaviors are like bathing. It's a normal behavior for them. Playing in the cage bottom, not sleeping in the cage bottom, playing in the cage bottom. Cleaning, self-cleaning, malting, sleeping, regurgitation, eye pinning, body shivering, vocalization, head bobbing, and biting. Don't worry, I will explain one by one in detail. Bathing is the thing that the bird enjoy a lot. That is a good thing of this. When you're giving a bath to the birds, they enjoy a lot. So whenever you are giving, usually what if you are put separate otherwise, if you in the same drinking water bowl it after drinking, they will bath it. That's very common. And I want to stress this behavior, that is a playing on cage bottom. I am stressing the word playing because playing in the cage bottom is a normal behavior, but sitting on the cage bottom is an abnormal behavior. Okay, playing means the bird will be very active, they will be vocalized, and why? Because in the normally we put the toys in the bottom of the cages. That's why bird comes to the bottom of the cage and vocalizes. That's a normal behavior. But when you see a bird sitting ideally and weak, that is an abnormal behavior. So I'm stressing playing on cage bottom is a normal behavior, but sitting with the inactive bird in the cage bottom is an abnormal behavior. Got it? Next one is preening. Preening is nothing but normal grooming or a normal cleaning process by which a bird. You all know the bird just in front of the tail, they have a gland called as uropygeal gland, also called as preening gland. You can see this macaw bird is taking the contents of the preening gland and evenly spread on all the wings so that it becomes waterproof. That is a normal thing. That's if you're seeing a bird preening, you can see it's a normal bird. And molting. Molting is nothing but shedding of the feathers. That is very normal in the birds. And there are two feathers. One is a primary flight feathers or large feathers. The tail and wing feathers are the large feathers or flight feathers. And there are small feathers or covered feathers are there, or secondary feathers are there. That is of head and chest. The good thing of large feathers is that a bird will molt twice yearly. That means every 6 months, or a lifespan, a span of 8 months to 6 months, they will molt it twice yearly. That is very normal. And but head and chest feathers, no, they will keep on shedding it several times in a year. So this is a normal thing. But if you're seeing a bird molting more than 2 times their large feathers, that's an abnormal behavior or destructive behavior that you have to take care. Okay, I think I am clear to you. I don't think I'm audible to you, and I'm not in a haste. Okay, no, okay. Because I can't hear you and see you all people. That's why. Okay. Next one is that sleeping. Sleeping, the bird after 24 hours, half of the time they will sleep. 9 to 12 hours. Usually in the evening time they prefer to sleep. And you can see a conure over here. It's called as cat napping. If you see a bird like this, one leg on the perch and sleeping. This is called as cat napping. It's very normal in the birds. And you can see a macaw over here. This macaw, if you see a macaw tilting the head 180 degree, and it's hooking the beak into the wing feather, this position. This is also a normal. This is a two normal sleeping procedure. This is a deep sleeping procedure. This is a napping. Whenever a light voice comes, they will open the eye and they will become okay, like that. That's called as cat sleeping. And next one is called as regurgitation. So there is a two terms I would like to tell you. One is regurgitation. One is regurgitation, and another one is vomiting. Vomiting is abnormal, but regurgitation is normal in some cases. Regurgitation is nothing but undigested food if they vomit. That is called as regurgitation. You can see this GIF. A mother, a parent is feeding the undigested food to its offspring. That is a very normal regurgitation process. It's an active bird. Okay. And also males will also exhibit this regurgitation when they in the breeding season as a courtship behavior. They will put the food to the attract the females. And also some birds I could see they will regurgitate. They are a very normal active, but oftenly they will regurgitate. People will come to you because as an honor bonding, as a bonding with the honor, this birds used to what we call regurgitate to the honor, considering him as a cage mate or affection or love, I can say. So that is very normal. This is called as eye pinning. Eye pinning is nothing but pupillary dilatation and constriction. You know, most of you might be knowing the anatomy of the iris muscle. In animal, iris muscles are involuntary for us. We can't, according to the light, we can open, dilate the pupil, that is iris, and constrict the thing. But the thing is that in these birds, they are voluntary. According to the mood, they could able to constrict or dilate it. That is the good thing of these birds. So whenever they are excited or they are angry, or they are lovable, they will keep on flashing. What they do is like, I think you can see the video. They are keep on constricting and enlarging. This is called as flashing. This can be either excited or angry or love and affection to the owner. Just like you can see a owner is patting with love. So that is called as eye pinning. That is a normal behavior in birds. You can see shivering. Shivering is abnormal if the animal is weak and not eating and sick bird. But in cold weather, the bird will shiver. And if the bird is nervous, they will shiver. And if they are into new people environment, they are excited, they will shiver. That's very normal. And another one is that vocalization, chirping of the birds, you can tell. The common stimuli that a bird chirp is during the bathing time. When the bathing time, due to the social behavior, they were so happy, and whenever they are in good mood, whenever we are in good mood, we sing. Just like that. Whenever they are in good mood, they sing. That is a vocalization. If the bird is not vocalizing, that is a problem. Sometimes breeders will on phone, they will call that, tell that, sir, my bird is keep on screaming. Keep on screaming. There are different. That is chirping and screaming. That both are different. If they have some pain and all, they scream. That is a different sound. But once we are into this rearing, then only we could differentiate whether just screaming or chirping. Chirping is normal, but screaming is abnormal. Bathing time they chirp, and when they are hearing loud noises like music or vacuum cleaner sound and all, they used to make noises at the feeding time. So most of the owners, after hearing the vocalization only, they, oh my god, it's a time to feed my bird, so they will go and feed it. So you can see also birds will chirp at dawn and dusk. Dawn is the early morning, dusk is in late evening. Birds will during their normal wild behavior, they do that. And another one is a head bobbing. You can see the video over here. That is head bobbing can be normal, just like an attention seek. If they want to seek the attention of the owner, they will keep on bobbing the head like this. When the bird is excited, they will do that. And also when small birds, just like a bonding, when they see their mother is feeding them, they will, yeah. Just like human, we are getting food, we will do like this, no, just like that. And also, lorry birds, it's a male courtship behavior of lorry bird, male bird to attract the female. While they are breeding season, they will keep doing that. Just like this, they are calling the female, so the female will come and they will do the things. Another important one is the biting. Biting is nothing but it's can be normal. Why? In 3 cases, biting is normal behavior. One is that whenever a bird from upside of the cage, when come down, they will use their beak. They will bite the beak. With the biting, they will hold the cage wall and come down. In that case, to balance their body, they are using biting. That's very normal. And self-defense. They are into new environment, new birds. First self-defense is like biting. That is also a normal bird. And also as a bonding with the owner. See, you can see a biting like this. When the owner comes, that is called love bite. It's a love bite. Okay, love bite is also normal. And now, till now, I spoke about the normal behavior in a bird. Right now, I'm going to abnormal behavior in birds, like feather distraction, sitting on the cage bottom. This one I have already told. Feather fluffing, shivering, regurgitation, and vomiting. Very mean, rude bird suddenly turn friendly. That all are abnormal behavior. Decreased fecal output, open mouth breathing, tail bobbing, falling off the perch, inappropriate mounting. All this we will see in detail. Okay, feather destructive behavior is it's very there are numerous causes for a bird to remove its feather plucking or feather picking. Like you can tell any physical and behavioral causes are there. Why it is a causes, what is a remedy, all I will deal in my next part. It's a big topic and I have to stress it. It's a 5 to 6 minute uh, I want to tell about that. But just now I just want to show you which is an abnormal behavior. I'm not going into detail. So when you have a mild bird like this, mild feather destruction, you can see this is a moderate feather destruction. This is severe. All the feathers, all the secondary and primary feathers have been removed. And after removing the feather, they started taking the skin also. Skin and subcutaneous also will be removed. This is all different levels of destructions. That I will deal it in my next class. Then I told about sitting on the cage bottom. Playing on the cage bottom is very normal, but sitting on the cage bottom, this is very, because why? Because the bird will be very weak and they can't climb up the perches and go up. That's why they have been in the down or low area. This is a medical emergency. If a bird can't climb up, then been sitting on cage, the owner have to see that the bird is having a problem. Like that only in a group of 10 birds, one bird is sick, they will come up the down cages. So we could able to see how this bird is weak. Another one is feather fluffing. Whenever a bird feel ill, they will be puffy. Like why? Because normal thermoregulation mechanism in the bird will be hindered when they are sick due to any infection or inflammation or anything of that sort. So what happened is that in order to conserve the body temperature, they puff it, because in between the feather and the skin, that area, the air will be getting hotter, and that so just like a blanket. When we have fever, we will cover our body with blanket. Just like the mechanism only, they're covering the body with the puffiness, fluffing, and they start shivering. Shivering why? Because while shivering, what happened is that the metabolism will increase due to the muscle movement. That metabolism energy can be converted to heat energy to preserve the body temperature. That's why temperature regulation, they are becoming puffy and shivering. That is an abnormal behavior. And the other one is vomiting and regurgitation. When a bird is very this thing, if they are putting off or they are vomiting digested food, they are called a true vomiting, or half digested food, which is a regurgitation basically. There are numerous causes are there, like there is some obstruction in the GI tract, especially in the esophageal area, and some inflammation, especially the goiter. That means the inflammation of the thyroid, hyperthyroidism. What happened is that it stresses the esophagus, so that bird can't eat the food. Whatever food eating, it will come off. And any infection, heavy metal toxicity like lead toxicity, which is very common in pet bird, and due to any tumor conditions in the neck area, they will keep on doing that. And another one important thing is that whenever a very aggressive bird suddenly turns friendly on a fine day, that is an abnormal behavior. If the bird becomes sick, they become more quiet and docile and very less aggressive. This is a picture during my practice. This parrot is actually a very aggressive bird, but they become more docile, so I can hold it. Okay, that's it. And another one important thing is that open mouth breathing and tail bobbing. This is a very important slide. Everyone, please lend your ears. This is a take care of home message. You will have to, you will get one of this thing in your practice when you are going into avian practice. Open mouth breathing. That means whenever there is obstruction in the lower airway tract obstruction, they will have open mouth breathing, pneumonia, and all those things. You know the basic anatomy hopefully, because in birds they do not have a structure called as diaphragm. They don't have diaphragm. So how the respiratory movement happen? Because with the keel musculature, by moving the keel musculature up and down, they are going for the normal respiration. So what happened is that whenever the obstruction is there, they can't move their thoracic area. So they feel suffocation. That's why they will go for bobbing of the tail. You can see the bobbing of the tail very carefully. We wash the tail. You can see the bird bobbing the tail. It's a sick bird. The only thing is a medical emergency. You have to nebulize it and go for oxygen therapy. And another one important thing is that falling off the perch. It's very normal if the bird sleep and fall off. You know, we also do that. While sleeping, we sometimes we sitting and sleeping, we sleeping and fell off. That is very normal. But when a bird is awake and normal and it keep on falling down, that is a falling off the perch is an abnormal behavior. Okay, got it. The major causes for falling off perches or loss of balance of the body can be any neurological problem or nutrition deficiency like hypocalcemia and any illness. When the bird is very weak, they can't be in the perch and fall down. These all are normal. So, I discussed about how to sexing method, identification method. Hopefully, you are not getting bored of my talk. Hopefully, I don't know. I'm just moving forward because we have a less time limit, 8 o'clock right now. I will rush to the topic. Don't worry. Another important one is how to handle a bird. If a person come with a bird to your clinic, most of us, sometimes honor itself is feared. We will tell, oh my God, sir, my bird will bite. I can't handle it. So we will think that if you can handle it, how can I? That's why I will give you some tips how to handle an aggressive bird, how to examine it. Okay. So in my practice, I have mostly use cloth or paper towel to handle a bird. That is the best thing to handle a bird. Turkish towel is very good. The gloves is of little value. If the very biting bird, you can use this lead aprons, lead oven gloves, or wear oven gloves. Whenever they pop, but you won't get accessibility to catch all of the bird. That is the problem with wearing this oven gloves. Okay. So I'll just show where we have a small citizen birds like budgerigars or lovebirds. We can handle like this. We can wrap it in a paper towel like this, so that it won't scratch and bite it, and you can examine. But only thing is that you can only examine the head. If you want to examine the head, only you can go for this technique. And this is a canary bird. You can hold it. So I think you can see the small duck over here. This is a small duck of my baby. I just want to show how is that with your two fingers, you can hold off the head like this. The small bird head, you can hold it with your two fingers, and with your thumb, you can stretch like this. This is the method to hold a small bird, like a lovebird or canary, and you can examine all the leg. If they scratch, somebody can hold the leg also. Okay, this is the method to hold a small bird. And if you're going for a medium-sized or large bird like African grey parrot, one person can with one hand you can ask your person to hold the head, and both the wings and the tail can be held together also. Okay, and pigeons is very easy. You can both the wings and the tail and the legs with one hand you can hold it. This is the simplest way to examine the bird. Only thing is that while handling, you have to avoid the chest area or keel area. If you keep on pressing the chest area, the bird will die in hand. That is the only thing. That's why I'm no any of my handling method. We are not concentrating on the thorax. Only we are concentrating on legs and wings. Okay, and this is a bastard bird actually. This is what I have taken from a book. They are using body harness. It's not widely practiced in India. With the help of canvas clothes and Velcro bands, you can see with the band underside, the legs can be kept in position, and with two Velcro bands, you can tie up it so that bird will be in normal position. They won't fly. And this is the how you handle the wild bird. When you are in government veterinary centers and all, you will get a lot of cases of wild birds. So they are very ferocious bird, and they are a very they are very fearful actually. Sometimes while holding itself with capture myopathy, the bird will die. So what the thing you have to tell? I usually tell to the forest official who bring the birds, peacock and all to me. I told them put a hood. Hood is nothing but just a cover the head. So it will be dark, so the bird will be quiet. That is a good thing. You can see the hood over here, and you can hold if a big bird, you can hold the leg and body like this. If you don't have any hood, don't worry. Take a black cloth, put on the head. That's it. And if you're going for protected dangerous bird like eagle, they will scratch and bite. You can use the oven gloves or lead gloves and all, so that if they are getting the peck also, you will be saved. Okay. And this is the best method and very simple method I am using in most of my species of the birds coming to my practice, that I have kept my own Turkish towel. It's a Turkey towel, simple Turkey towel. You can wind it just like cat. You are winding the cat just like that. You can go for this simple and method and perfect and best method. And one more thing I want to tell you: whenever you are examining a bird in a cage bird, they will bring in the cage. They will take from the cage and examine. So my simple request is that you have to look the bird in a closed enclosure. That means you have to close the door and even the windows and off the fan. That is a very important thing. You have to off the fan, because when the bird sometimes while examining it will bite, so the owner will let it, so it will fly off. But if it's a it will go and stuck on the fan and it will die. That is happened, I have seen in my own practice. That's why I'm telling you basically. So you can go for so whenever you are examining and the bird fly off, you can use fishing net. You can see like this. You can take the fishing net, put it on the bird, and take it. That is a method to recapture the birds. Don't ask a bird to put in the cardboard box, because most of the birds, they will eat on the seeds. Their beak are very strong. Okay, so that they will cut through the cardboard box and they will escape. So never put the bird in a cardboard box and bring to you. Now we are going for the basic thing. One is the physical examination. Okay. So I would like to bring into notice, from here onwards, we are directly moving into our clinical side. So I want to have your all attention. I don't know, you are getting bored or what. Same pace, I will go for it. I think you don't want any in between, what we call, any refreshment. I don't know. You don't want, I think. I will continue it. Okay. Thank you for the patient hearing. So what I come to say is that avoid chasing a bird prior to the handling, because they will be excited more, adrenaline rush will be more. So we have to make it calm. I always tell to my client, whenever you are bringing in the cage, put a black or a dark colored towel over the uh, cage, so that bird will be very quiet. Like that, you can do it. Then if they are very aggressive and wild birds, you can darken the room, means put a small light, close all the things, and you can do it and you can examine it like that. And I already, this is an important thing I have done here, is masking phenomenon. Masking phenomenon is very much important, because why? Because all the bird, they are all coming from the wild predators, wild predecessors. So the thing is that these birds have been all have a predator species. So mostly in a group of 1,000 birds or 100 birds, the predator mostly concentrate on sick birds or juvenile birds or very old birds, because that is easy to get and off. So what happened is that whenever a bird is sick and if he's showing the symptom, what happened is that predator species will identify it and come and eat it. So it is their common thing to mask the problem. So most of the birds having a mild or a subacute problem, they will mask. They will pretend as they are okay, no problem. But when you see that bird is really sick, that means that it is an acute case. In acute stage or later stage only, the bird will exhibit the symptoms. So that is an important thing, masking phenomena. You have to. So next one is that when you are examining a bird, you can see some ocular discharge, respiratory distress, fluffed up thing, bright green feces, and all those things. You have to suspect for a basic zoonotic diseases called as chlamydiosis or parrot fever. So don't worry, I'm just to give a heads up only. I will deal it with the chlamydiosis, everything in how to identify the chlamydiosis, what is the treatment of chlamydiosis, what the precaution to be taken. Everything will be dealt in my next class. Don't worry. And one important thing is that you have to keep your bird in quarantine when you are bringing a new bird. That is, you have to stress. Otherwise, they will get all the infection. So on the physical examination, we have to examine from the head to the tail. All the system systematically have to examine. First one is the eye. Eye have to be clear, round, centrally placed, moist and shining, no ocular discharge or anything. This is a normal eye. You can see the right side eye, one of my patient having a periocular swelling and discharge from the eye. This is an abnormal thing. And next one is thing you have to see the nares or nasal opening. It should be clear and open and centrally placed operculum. And in Badgerigar, I already thought about cere, C-E-R-E, cere. This is the muscular area called the cere. It has to be normal. But see this Badgerigar, we have something abnormal. This is cere hypertrophy. This bird having hypertrophied cere. And if they have chlamydiosis or something, they will have occluded nasal so that they can't breathe off open mouth breathing. And the next one is beak. You know, beak has two portions. The upper beak is called as maxillary beak. The lower beak is called as mandibular beak. Okay. They have to meet evenly. This is the beak. You can see a normal beak over here. And you have to see the beak for excessive growth or abnormal. You can see the bird over here, lovebird. You can see the upper maxillary beak is overgrown. So only thing is that we have to trim it. Some of the causes like due to soft perch or some calcium problem, they have this like problem. You have to identify the body's basic cause and you have to treat accordingly. Here you can see a lateral deviation of the upper beak. So this is called as scissored beak or lateral deviated beak and all. This is abnormality. Okay. So next one, the thing you have to examine is the oral cavity. You know, all birds are biters. So, but also with the help of the owners, we have to open the mouth because there is an, usually you can go for a simple horoscope. With the help of horoscope, you can see, or simple torchlight, you can open the mouth and examine the body. In small birds, I use this gem clip or paper gem clip I have used in birds. Small birds, we can keep it open. That also you can do. The good thing if you go for oral cavity examination is that there is a part called as shona. Shona is nothing. It's a slit like I don't know whether you can see my cursor over here, pointer. This slit is called as shona. Shona is nothing but the slit that separate the upper nasal cavity from the lower oral cavity. So if the bird have any problem, if you shake the Schwanner swab and go for culture and sensitivity, you could able to identify some of the diseases, both oral cavity digestive diseases and respiratory diseases. That is a good thing about the Shona because it's a partition between respiratory system and digestive system. So that if you take a swab from that, you could able to diagnose any digestive problem or respiratory problem as well. Okay, and the ear opening. You know this. You can see the clear ear. You can see like this polyp that you have to see that abnormal. And when you are going for the seeing the head feathers and body feathers, you have to see. If you see a bird like this with no feathers at all, see head feathers and the tail feathers, no feathers are there. Even their beaks are abnormal wear and tear. This is called as this is an important viral disease. It's called as PBFT, cetosine beak and feather disease. PBFT. If you have seen a bird, this is a bird. It's a very dreadful disease. Only thing is there is no treatment. Only euthanasia is there. Otherwise, it will spread to all of the species. All the cetosine birds are prone to PBFT. And if you see a bird like this, only chest one is removed. This is a clear case of self-plucking. This is a bird with self-plucking. And when you are thinking next, you have to go for wings. Wing you have to stretch it to access the mobility, to see the length and all. That you have to see whether any fracture, anything is there. You have to examine it. And another important thing I have to stress every of my practitioners is that you have to use a common balance to weigh the birds. Routine weighing have to be done because by seeing the bird, you can see, for example, this is an African grey parrot. If you see a African parrot very fluffy and all, you see that it's like a half kg or 500 grams. But in live, you can see there's 354 grams only. That is the thing. Externally, this bird looks very heavy, but they will be very small. Only the feathers are big. That's the thing. So if you know the correct body weight, then only you could able to calculate the dose, even antibiotic dose, anesthesia dose. It's very important. You have to calculate the body weight. Then only you have to calculate anesthetic dose accordingly. So you can use like this. Even the perch also you can use. And over the perch, you can keep the bird even. This is the normal body weight of the bird. So this I have taken from the textbook. And the common birds come to your practice. So many are there. I'm not going into detail. If you are interested, I will give the soft copy to self-paid people. They will distribute to you. This is a common body. For example, see, the African grey parrot 400 to 500 grams are there. Like see, macaws weigh around 1 kg. That all I will send to you. Okay. The next thing you have to examine is the keel musculature. This is very important uh, diagnostic important method. You have to examine the keel bone. Keel bone consists of the chest bone is a keel bone and musculature. These two are the things we have to take care of. And on my right side, I have given 1, 2, 3. This is a meter. That is bird size meter. Keel bone meter. That is the number 3 or the grade 3. The bird is ideal bird. They have uh, good keel bone and even breast muscles are there. If you are seeing a bird like this, keel bone will not be easily felt and the bird is fully covered with the muscles and yellowish skin is there. That means it is the overweight bird. That is a 5, uh, quality number 5 or grade number 5. If you are seeing a grade 1 bird with no muscle, unpalpated muscle, when you are touching, you are directly touching on the keel bone. The breeders will colloquially tell that it is called as what we call that problem is called as blading, just like a blade. When you touch the blade, that much sharp the stone is there. If you're seeing a bird with a sharp keel bone, that is a clear indication that the bird is a sick bird or chronically ill bird or undernourished bird. Okay, so next one is that we have to examine the limb. I have to pay attention to the joints because they are very prone to the gout, articular gout. And another important thing is that bumbled foot, which is very common. It can be due to vitamin A deficiency or due to incorrect environment or purchase can be there that have to be examined. And another important thing is that when the bird having the closed ring, sometimes chance of keratin buildup. Okay, so once it's keratin built up, they can't move the leg band. It have to be freely moved in the tarsometatarsus bone. If it's not freely movable, what happens is that the area below the ring will get swells up and get gangrenous. That you have to see due to constriction of vessels. So it's like that. You have to cut and remove this one. And the another important thing is that this is a common thing, egg-bound condition. It's very common in African grey parrot, cockatiels and all. In your practice, you will come up one case of egg mount surely, because female, if we have having an abdomen, it's very much swelled abdomen or edematous abdomen, you have to think this one. Egg bound is the first differential. You can see the abdomen like this. You have to take that X-ray. You can see egg coming and blocking the cloacal area. So what is egg bound? How to control the egg bound? How to manage egg bound? I will be taking in a special class next part. Okay, don't worry. And examination of cloaca. Have to see the vent area or backside area. You have to see some inflammation is there, some uroliths are there, or some prolapse. This is a African grey parrot with chronic prolapse, cloacal prolapse like this. We have to deal with. And I already told about a gland called as uropygeal gland or queen gland at the base. Yeah, this is we have to examine that too, but don't search uropygeal gland in Amazon parrot because they don't have uropygeal gland. Okay, so uropygeal adenoma, say budgerigar having a uropygeal adenoma, I can see this picture. And there are, I already told about two feathers, general feathers and flight feathers. We have already told. And I want to tell something about the down feathers. Small feathers is the down feathers, because it's produced by the disintegration of the tip of down feathers, because it's look like a small whitish powder, or just like what we call just like a pityriasis dandruff. No, it's look like a dandruff, but it's very normal, because why? It will make the rest of the feathers waterproof and help to lubricate them. That's why the good thing of down powder. So if you're seeing a down powder in a bird, don't be panic. It's very normal. Don't think that it is a dandruff and start with antifungal straight away. Don't do that. Okay. And another one is that I will move to the general feather. If there is any feather loss is there. Already I told about circovirus infection of PBFT. Don't worry, and check for any external parasites are there, like feather mites are there, red mites are there, or lice are there, ticks are there, or fungal infections are there. Okay, that we will deal it with in detail later. And I have given a poster over here. If you have your bird with feather mite damage, you can very well identify. This is a cockatiel. You can see the crest feathers is like chewed or notched. you can suspect for a feather mite. And you can see inflammation around the eye, and there is periorbital dermatitis. You can suspect for feather mite. And you can see the nostril is red because feather mite is very much itchy. So the animal bird keep on scratching the nostril face so that the nostril will get red in color. And you can see the thin feathers on the cheek patches and all those things. If you see any of the symptoms in a bird, you can suspect for feather mite. So next I'm going for a very short about the nutrition, because it's a very important thing. Nutritional diseases are the very common diseases that come into our practice. And I think most of you have went to a different um classes of about avian nutrition and all those things from different speakers across India, I know. So I have seen the detailed classes. So I'm not going into detail, just to make one or two heads up. You know, as a thumb rule, when you are feeding your bird, you can give 75% of the formula diet and 25% other diet. Formula diet is nothing but it's a like what we call, it's like a balanced diet. It's like a pellet or soft food you can give. Other diets include all these cereals and all. We will see. You can either purchase soft food from the commercial companies like Beta Farm and KT and all. You can feed this pellet, not a problem. Otherwise, if you want to prepare a soft food at home, you can ask your readers to do that. For this is an example. It's a model how to prepare a soft food. For that, you can go for 30 gram of brown, sorry, brown bread, 30 gram, one boiled egg with shell, one, and 15 gram of brown rice, 2 ml of virgin coconut oil, and 2 ml of cod liver oil, mixing 1 gram of any of the mineral mix available, and one probiotic capsule. This everything you can mix it and together and keep it. That is a that together for 100 gram of soft food. This is a model. There are so many soft food models are available across. You can search it in the Google and get it. And the other foods what you can feed is that seeds, oil seed. This you know that most of the owners they will feed on seeds because they know only how to feed seeds. Or mostly some owners I have seen they only feed seeds, no other food. But if we are feeding some oil seeds like sunflower oil seeds, that will of course make the bird more obese. Unless and until if the bird can fly in the flight cages and all, then it's well and good. You can feed the oil seeds. Otherwise, no. Otherwise, only feed this oil seeds during the breeding season. Better you can give the seed mix, different seeds together. When you are going for any cereals, you can give the grams and all sprouted. That will have more the protein. Vegetables, fruits, different fruits can be given, and even live food can be given, mealworms, crickets, and all. Some people used to feed milk and milk products, cheese, and all those things. It's a good calcium and protein source, of course. And there are special birds called as lories and lorikeets. I have shown you that their tongue is having a paintbrush-like appearance. They are specifically like straw only for suck the nectar. So when you are having a lories or lorikeet, you have to feed honey and the nectar mix. Commercially available mix are there, and coloring foods are there like carrot, capsicum, cayenne pepper, and all. The good thing is that they contain carotene. When you are feeding your bird with this coloring food, that will reflect in your body. That means they have good plumage, their beak will be having good color and all those things. And for calcium source, you can feed grit and cuttlefish, and even the table scraps, scrambled eggs, cooked rice, cooked sweet potato, all can be given. So this is a picture of what all the food you can feed to your bird, like cereal, seeds, and vegetables and fruits, different fruits. Okay. When you are rearing a African grey parrot or Amazon parrot, you have to give calcium. These are the two notorious species, very prone for hypocalcemia. So you have to go for that. And the thing is that whenever usually your owner will come to you that they will feed only seed, then you educate them. You tell that you have like this, you have to go for soft food. This is a formulated diet, that and this thing. But they will tell you that, sorry doctor, but my bird is not eating that. That is a major problem. Whenever I switch to new balanced diet, it's not eating. So you can you can tell any of these four procedure to them, how to make your bird eat the balanced diet. One is that mixing the old food with the new food. Old seed mix, 75% with the new balanced diet you can feed. Like that you can increase 75 to 25, 25 to 50, 50 to 100, like that 100% new food can be given. Second method is that feeding time. Bird will be hungry at the morning time because after night they won't feed it and they will be in fasting period. So whenever they're coming in morning hungry time, you can feed the new balanced diet. So the bird will eat it or soft food you are giving. So one thing is that when you are going for small birds, don't fast them more than 12 hours. And if you are going for a big birds, don't fast them more than 24 hours. That is a thumb rule. Small birds like lovebirds don't fast more than 12 hours. Even doing surgery also don't do that. No need of fasting at all. And small birds eat more comparatively that of bigger birds, according to body size, I'm telling. And you can see the droppings also, whether they are eating that much quantity droppings are coming, don't worry. This is third method is that food presentation. Some birds have favorite spots are there. Like when you're thinking of small birds like budberigar cockatiel, the ground level, if you keep the new food in the ground level, that is a favorite spots for them. They will come and eat it. And some other birds, mostly other bigger African grey parrots and all, they like to eat by foraging or higher, can keep the bowl higher. They like to fly it and come and eat it. And another food enrichment is called as foraging, their normal behavior. If you give a watermelon, they will eat, they will remove the green area, they will remove the red area, and they will eat the seed. That is a foraging behavior. That means in wild they like to, they want to work for their food, not like human. Of course, we have to sit idly and eat. That is our normal mentality, including me. But birds are just opposite. They want to work for their food. So like that foraging food, so that I can keep a new food in tightly packing in old food, and they will remove it and eat the food. That is another thing. The fourth method is that social interaction. You have to, if the bird see other bird eat the food, they will eat it. Just like human, we also have the same. These are the food which we can give. Some other foods we have to avoid in birds. One is alcohol. Another one is coffee. You can cheers with your friends, don't with your bird. Okay, I used to tell to my clients, give cheers to your friends, not problem, but don't cheers with your bird. Okay, even coffee also, morning coffee also, hi, don't cheer it. Okay, then you don't give chocolates. I love my bird, I love my cow, I give Kit Kat every day. No, it's contain theobromine. It's very bad to the bird. And another plant called as rhubarb, we usually feed to the animals. It's contained oxalic acid. Don't feed to your bird, but you can give greens to other greens to your birds as well. This is a fruit you all know, avocado, also called as butter fruit. It's very poisonous to most of the species like African grey parrot. Better to avoid. And seeds of apple, apricot, cherries, plum, and peach. These all contain cyanide-like substance. This is potentially harmful for the birds. So, if you have seen a bird eat one apple and one in that seed, don't worry. If you're continuously eating the apple seeds, then you have to worry. You have to remove and give. If you eat one seed and all, don't worry, don't worry. You say, oh, it's cyanide person, you have to treat accordingly. Don't worry, don't do that. Then citrus fruits like orange, lemon, musambi, they are all good source of vitamin C, but it causes scarring or diarrhea in some of the birds. So use with caution. If your bird is well good with orange and all, give it, not a problem. But if you find some scarring or diarrhea, stop it. And vegetables you can give except that onion. Onion thing is that onion contains sulfur compounds. In long run, that will cause anemia. Even garlic will cause problem. Cabbage, mushroom, cabbage all contain goitrogenic substance that will help in that will produce goiter. That is all the problem. But all once in a month, if you give one onion or one garlic, don't worry. Don't think that it's a problem. Don't worry. Even garlic claim to have some deworming effect also. Once in 2 months or 3 months, if you give garlic, don't worry. So I will move to the nutritional disorders within no time. It's very not everything, very specific disorder because I don't have much time with me. Because why I am stressing nutritional disorders, because when a bird in captive bird, 80% or 90% problems are due to the nutrition or diet. Then comes the environment or management. Then only other problems. Okay, the problems, the bird is presented to your clinic. 80% of exotic breeds have some metabolic disease, so diet problem, and very less comes environment due to the management, mismanagement of the owner. and very less only other problems like biting from predators and all, very few, less than 5%. Okay, that's why the major problem is with nutritional disorders. I want to stress the nutritional disorders. So digestive disorders, when we think of this, one important thing, I think this is very basic thing which I'm telling right now. Most of you might be knowing, but just to refresh your memory, I'm telling, the fecal, bird does not have separate feces and urine, everything together coming to a common opening called as cloaca. The dropping of a bird consists of three different parts. One is the feces part, this green one, brown to green colored one, and this white part is called as urate or uric acid, and this watery portion is the urine. So it consists of feces, urate, and urine. Okay, this feces is normally brown to green in color. The urate, you can see my cursor moving. It's crisp white, very white and moist. But all the dropping, if it's kept for one day, it become slightly green due to the presence of biliverdin. That is also very normal. All the droppings, but a new dropping with green, you have to worry. Okay, urine is like it's like extend to a couple of millimeters, and if you're seeing a bird accept urine, so much urine, that is polyuria, excitement polyuria. If you are holding a bird, it will pass the dropping. In that case, it will be like water. It is called excitement polyuria. So this is a normal one. So I'll move to the abnormalities. Normal, you can see this is a Budgerigar or Budgie dropping, normal dropping, feces and urate. And this is abnormal dropping. You can see excess of urate and excess of urine is there. That is a diarrhea. And if you're seeing undigested food in the feces, uh, it's some undigestion problem. And if we see that after the passing like this feces, the bird is like this, you can suspect for another borna virus infection and all those things that we will see into another class in detail. And if you are seeing a very bulky droppings, it can be due to maldigestion or malabsorption. In breeding hen, that is breeding female, passing a very bulk dropping, that is very normal, don't worry, it's very normal in a breeding hen. If you have some abdominal growth or pelleted diets continuously or new food, they will show very bulky droppings. And another important thing is that dark dropping is melena or a dark color, blood in the feces. It's like anorexia. If in case of if the bird is anorectic, anorexia, you can see like this droppings. And in case of some intestinal hemorrhages are there or coccidiosis, like that. What happened in anorexia? First, there is if the bird is not eating for 2-3 days, then suddenly the urates become green in color. Then it will move to a dark green in color. Then it moves to charcoal in color. Means like bleeding. What happened is that bird is not eating, but in their gizzard, the digestive juices are producing. What happened is that this digestive juices will digest the intestinal mucosa. That's why this dark dropping is coming in anorexia, chronic anorexia. Okay. And if you're seeing a very malodorous, very smelly dropping, you have to suspect for some bacterial or fungal overgrowth. If you are seeing a green color, this is a urate, white. I told urate or uric acid content is white in color. If you're seeing a green urate, you have to suspect for liver disease. It's normal in all the droppings, I already told you. And if you are seeing a pink or red uric acid, white instead of white, it is become pink or red. You have to suspect for some renal diseases like lead poisoning. It's very common. Lead poisoning is very common in birds. I have got a number of cases in my clinic because whenever a person is painting its new cages, the paint contains lead. Bird will pick the paint and they'll come with the lead poisoning with neurological symptoms and a reddish this one. Most of you might be seeing that. Then another one is that instead of white in color, if the urate is yellow, it is due to anorexia. And if you have given a bird vitamin B injection, recent injection, you will have a orange urate. Don't worry, that's very normal. And if you have a thick pasty urate, you have to see that bird is not drinking water; it's dehydrated. And if you are seeing a polyuria, excessive urine content, you have to suspect that it's either excitement or due to some other diarrhea problem. And if there is not at all urine content, you have to worry, it's an abnormal. And there is any discolored urates or fresh blood. If you have any fresh blood in the feces like this, you have to see lower GI tract problem like cloaca problem or oviductal problem like that. So now we are moving to the respiratory disorders. Like this is very common squeaking or wheezing sound. That is due to iodine deficiency. What happened is, the thyroid gland is situated in the neck, very closely with the trachea and the esophagus. So when there is enlargement of thyroid glands, it will press the trachea. So due to the trachea, what happens is that the swearing sound will be having the problem, iodine deficiency. And even vitamin A deficiency also, there will be obstruction in the syrinx and you will get the change in sound. Another important thing is that the airway obstruction, especially the aspiratory pneumonia. Because whenever the bird is not eating, what the owner tried to do is that he keeps on giving the bird feed the bird hand feed formula that will directly go into the trachea and the bird will be aspirated. So this is a case in my clinic in Kolkata that bird has come with aspiration. So I have cleared off the pharyngeal tract or respiratory tract, then gave nebulization and oxygen. This is an emergency. It's an emergency critical problem. So I'm only talking about 2-3 nutritional deficiency problems. So many nutrition deficiency problems are there. If I'm starting with and telling you, you have to go for 3 hours or 4 hours. I'm not going to that. I'm not going to check your patients itself. I already checked your patients, I know. Sorry. If you have a vitamin A deficiency, you can see abnormal wear and tear or abnormal growth of the beak. And you can see hyperkeratinization of the fingers and digits. You have suspected for a vitamin A deficiency. If you are seeing hypertrophied serrae, and if you are seeing like this hyperkeratinized lesions in the face, one of the differential is vitamin A. There can be numerous like Pneumococcus infections, feather mite infection, or fungal infection, and all mange infection. All this produce the same lesion, but one of the differential is vitamin A. So if you check the skin scraping, you will get it. And if you have seen eye sinusitis and eye problem, one of the causes, I'm stressing that one of the causes vitamin A deficiency. Don't think that Dr. John has told that eye problem, it's a vitamin A deficiency. Don't do that. You have to differentially diagnose from some other respiratory tract infection like mycoplasmosis and those things. And conjunctivitis, edema below the beak. These all are one of the causes vitamin A deficiency. Cockatiel, it's very common. They are prone to bumblefoot. That means vitamin A, vitamin A is very much important for maintaining the skin squamous cells. So whenever there is vitamin A deficiency, squamous cells will be affected and that will cause bumblefoot. This is a grading of bumblefoot disease. We can grade at 0, 1, 2, 3, and 4. 0 is a normal leg bumblefoot, normal foot. This is grade 1. There is only, you can see very slight lesions in the foot pad. When it's advanced to 2, 3, and 4. 4 is the last grade. Here you can see completely degenerated or enlarged foot pad, and all the joints are affected. Just like arthritis, all the joints are affected. So you can, like if you're getting a bumblefoot, you can, or a vitamin A deficiency, you can start with oral vitamin A, like beta A drops are available, or bird specific vitamin A drops are available. You can go for it, or even you can go for Vimeral or Lavitonage. Everything you can go for. Along with that, you have to supplement vitamin A rich food in their diet, like spinach, carrot, whichever the colored vegetables, fruits, they are rich in vitamin A. You can feed it. And sweet potato, red cayenne pepper, squash, this papaya, that egg, that yellow of the egg. They are a very good source of vitamin A. All this you can feed it. So next I'm going to vitamin D and calcium deficiency together. If some birds, we have seen the splay legs, like this, the nestling having like this small bird having splay leg. One is vitamin D or calcium deficiency of the mother. And if they have seizures and attacks in African grey parrots and Amazon parrot and African grey parrot, if you see seizures and ataxia, first thing to come to your mind is hypocalcemia only. Okay. Another one is poor feather development will be there, and poor beak development will be there, and pathological fractures will be there. You can see this is not a pathological fracture. This is a fracture of one of my client. I just want to show the fracture. The fracture of tibiotarsus. We are seeing pathological fracture without any problem, just simply breaking of the lip. You have suspected vitamin D deficiency. And if you're seeing a egg-bound condition like this, we have to suspect for vitamin calcium. One of the egg-bound condition, one of the causes calcium, vitamin D. There are numerous other causes are there that we'll discuss later. Another important disease that come up with our bird is fatty liver disease, because these birds will live long just like human, so that most of our diseases will be there for these birds also. One is the fatty liver, which is very common in human. Okay, that is nothing but the infiltration of fat in the liver, and mostly it will happen in the hand feeding birds. If you are feeding the bird hand feed every day, even if after the adulthood also, this, this is there. That means more energy, cholesterol rich diet if you feed will get of this thing. Females are more prone that than males for fatty liver. You can see dark green pieces will be there due to liver. Any liver affections, you will get dark green pieces. Legs will be swollen. And when you take the X-ray, this is a normal X-ray. You can see heart, liver, air sacs, lung, and all. This is a hourglass. Normal heart and liver will be hourglass shape. This is a hourglass. Upper hourglass will be heart, and lower hourglass will be liver. But if you see this X-ray, it's an abnormal X-ray. You can see the liver here. There is no hourglass. You can't very small heart and very big liver. This is a clear case of fatty liver or hepatitis. This is a postmortem finding which find in fatty liver bird. If you break open, you can see full fat infiltrated in the liver. This is the liver. This one lobe, this another lobe. This is the heart. Complete fat is infiltrated. And next important disease is that iron storage disease. Excess iron in diet that causes accumulation of iron in body. And other predisposing factor is that one is excessive vitamin A and C diet. Birds are prone. Genetically, some birds are prone, like lories and lorikeets, very prone to iron storage disease. Toucans and mynas. These three species are notorious for the iron storage disease. If we are feeding them excessive vitamin A and C diet, all of a sudden it will develop, and it is stressful. And earlier, the symptoms of iron storage disease, they will be asymptomatic. They won't exhibit any symptom. Later, they will have some loss of balance, weakness, and this iron they will deposit in the lung, so that they've started breathing difficulty. Abdomen will get distended as like ascites and paralysis. What are the symptoms? So whenever you are rearing these three species like lories, lorikeets, toucans, and myna, of course you have to go for low iron and vitamin C diet. The best fruits we can give to them very low in iron and vitamin C is watermelon, peach, pear, and apple. Peeled apple. You have to peel the apple and give. That is very good. And even if you can feed the bird, this lories and all, their food, that's well and good, which is very low in iron. Lorry foods are available, and even nectar foods are available. And this is the last deficiency disease, goiter. It's a hyperthyroidism, and swelling at the neck will be there. We can see this macaw with iron deficiency. And I told this thyroid gland is located very near to two organs. One is esophagus, one is trachea. So whenever the goiter happens, it will stress the esophagus. If you stress the esophagus, and bird will show vomiting and weight loss. And if they stress the trachea, I already told, they have breathing difficulty and wheezing sound. Wheezing or squeaking sound will be there. And the seizures will be there. Skin and feather abnormality will be there. Sometimes heart failure and sudden death will be there. This is a postmortem picture of a cockatiel. You can see how much enlarged the thyroid gland is. So what is the treatment? You treat in a mild case of starting cases of iodine deficiency, goiter. You can go for iodine supplements. Oral supplements are there, or even you can use Lugol iodine at the rate of 0.2 ml in a liter of drinking water. If you mix the Lugol iodine, it's well and good. Also, some foods are there which are goitrogenic, basically, like soybean, flax seeds, this is rapeseed, flax seeds, kale, broccoli, kale, cabbage. These all are goitrogenic foods. You have to avoid in these foods. And thus I come to the end of my first presentation. For further reading, you can very well use these books, which all are available online. Especially this Avian Medicine Practice, a very simple book, whether you can read it through. And you have to, any Avian practitioner must have at least an e-copy of this Exotic Animal Formulae by James Carpenter, which is contain all the doses of all the medicines which are using in birds. If you can go through that, it's well and good. Even you can get it in online also. Google, you can search it and download it. We have to keep one copy of that. So, as Swami Vivekananda sees this, that we have to be a giver. That's what I'm telling. So, if you have a knowledge, we have to convey it. That's why I'm here to convey my knowledge. That then only my knowledge will be spoiled. That's right. So, special thanks for Cellpet for giving me a platform to see and interact with all of you. There is a wonderful product from Cellpet, Birds, which is a very good product. And I have personally used that. And I will tell in my next presentation what is the dose, what condition you can go for this one. And next one is this is Corona period. You all know, stay home, stay safe. Then you think that Dr. John is stupid. He's asked us to stay home, don't go for job. Not like that. You have to go for your job, but take care. You have to go for all the precautions suggested by the government. Don't worry. And very thank you for a patient here. Once again, I'm taking an apology from all of you to having the technical problem in earlier. So once again, I'm asking uh, uh, this thing, what you call, apologizing every one of you. And if you have any doubt, you can, uh, if you have any doubt regarding my presentation, this presentation, you can ask it. Please don't ask about treatment and modality. That will be dealt in a separate class. That I will clear all of your doubt and then only I will go it. Don't worry. That is a basic, that is a specialized class. This is a very basic class only. Specialized class will be there. Next part will be dealt in, you all will be informed when is my next class. Then you can ask all the doubts. If you have any doubt regarding my presentation right now, you can ask that. Welcome. Okay. Thank you. Thank you so much.
Yes, Doctor, it was a wonderful presentation. Thank you so much.
Hello.
Hello, Doctor. It's a very good presentation. Thank you so much, sir, for giving so much.
1 minute. 1 minute.
Yeah. Hello.
Hello.
And Doctor, sir, there's again an echo. Sir, can you please mute your? You have to start only one. Hello.
Hello. I can hear
you. You change your. You have to just close your laptop voice. And then start from your phone, sir.
Yeah. I off it.
Again, it's a lot of chaos. It's not audible.
Sorry. If I off my laptop, I can't hear it. No problem. Tell me.
Doctor, no, okay. It's not audible, sir. Your internet connection unstable.
So can I move to question answer session?
So again, the same problem it started. You're not audible. You have to close your laptop speaker.
Yeah.
Before. So there are many questions. There are many queries are coming in the chat room. So pick the question. Pick the. Sir, you did previously. You close your. You mute your laptop speaker.
Hello.
Now it's fine. Good.
Yeah, I can see the presentations here.
Sir, if you allow, sir, if you allow, can I take 5 minutes?
Yeah, can I start asking?
Sir,
Hello?
then a chat room, there's a queries. So you read the query
Hello? Ah,
and you answer them, sir. So it's very easy for you.
so I will start answering the thing. Okay.
Queries in the chat room. There's a chat room.
Yeah.
So there are many queries. So you just read and you answer it.
Yeah, I will read it and I'll answer.
Yes, sir. It will be perfect.
So, first question, I think, start with the Dr. Hardeep here. Can we use lignocaine locally for small procedures in birds? Yeah, it's can be used, but there is just like what we call in birds, we have lignocaine toxicity is very prevalent. So we have to go for the correct dosing. We have to go for 4 to 6 mg per kg, even up to 10 mg per kg lignocaine locally you can use it. Okay. Okay. Fine. Sir, please explain, sir, while introducing a new bird to our group, how many days quarantine should be given? Ideally, 4 weeks quarantine, at least 3 weeks quarantine. Sir, please explain about tail bobbing and open mouth breathing. It's important. Yeah, tail tail bobbing and open mouth breathing, which is very common respiratory problem. If you have some respiratory problem, you have the bird with respiratory problem, you can very well what we call identify.
Hello?
Hello,
Hello?
hello.
Yeah, you can continue, sir.
Hello?
Hello.
Continue, please.
Continue. Okay.
Sir, the same problem
So,
started.
while introducing a new bird to our group,
Sorry.
sorry,
Tail
tail
bobbing.
bobbing.
Whenever
Whenever
you
you
can,
can,
I
I already
told
told
that
that
there
there
is
is no
diaphragm
diaphragm
to
to
the
the
bird.
bird.
So
So
what
what
happened
happened
is
is
that
that
they
they
are
are
respiring
respiring
with the
with the
help of
help of
keel
keel
musculature.
musculature.
So
So
moving the
moving the
keel
keel
musculature,
musculature,
they
they
are
are
respiring.
respiring.
So
So
whenever
whenever
they
they
have the
have the
problem
problem
with
with
the
the
respiratory
respiratory
problem
problem
or
or
something,
something,
what
what
happened
happened
is
is
that
that
they
they
will
will
shift
shift
the
the
thoracic
thoracic
respiration
respiration
to
to
the
the
abdomen.
abdomen.
But
But
just
just
like
like
animal,
animal,
they
they
don't
don't
have
have
separate
separate
thoracic
thoracic
cavity and
cavity and
abdominal
abdominal
cavity.
cavity.
They
They
have
have
only
only
simple
simple
cavity
cavity
called as
called as
tail
tail
bobbing.
bobbing.
That
That
too
too
is
is
not
not
possible.
possible.
That
That
means
means
shifting
shifting
from
from
thoracic
thoracic
to
to abdominal
abdominal
respiration is
respiration
not
is
at
not
all
at all
possible
possible
for
for
a
a bird.
bird.
So
So
what
what
happened
happened
is
is
that
that
they
they
will
will
keep
keep
on
on
what
what
we
we
call
call
try
try
to
to
respire.
respire.
That is
That's
why
why it
causes
causes
tail
tail
bobbing,
bobbing,
the
the
movement
movement
of
of
the
the
tail.
tail.
Okay.
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 Okay. Thank you.
Next
Next
question.
question.
Are
Are
in
in
birds
birds
lactose
lactose
intolerant?
intolerant?
Yeah,
Yeah,
yeah.
yeah.
One
One
doctor
doctor
asked me.
asked me.
Yeah, yeah.
Yeah, yeah.
The thing is
The
that
thing is that
that's
that's
what
what.
when
Well,
I
I
have
have
already
already
told
told you
that we
that we
can
can
use
use
dairy products, no
dairy
problem.
products, no
But
problem. But
as per
as
as
per
the
as the
theory,
theory, they
they
can't
can't
digest the
digest the
lactose
lactose
as
as
such.
such. Okay,
Okay,
but
but
they
they
can
can
utilize the
utilize the
calcium
calcium in the milk and milk products.
so that's what
So
I'm
that's what
telling.
I'm telling.
Whenever you are
Whenever
giving
you
milk
are
and milk
giving
products,
milk and
used
milk
with
products,
caution.
used
If
with
you
caution.
finding your
If you're
bird
finding your
having any
bird
problem
having any
with
problem with
milk, don't
meal,
use.
you
But
don't
some
use it.
very well
But some
tolerant
very well
extract
tolerant,
the
they will
calcium
extract
part and
the
protein part
calcium
from
part
that
and protein
and
from
leave
that
behind the
and
lactose part.
leave behind the lactose part.
In that case, you
In
can
that case, you can
use
very
it.
well
But
use it. Okay.
would like to ask
Would
that
like to ask that is
lead
any
poisoning by
lead
keeping bird
poisoning
in
by
painted
keeping
cage.
bird
No.
in painted
The
cage?
thing is
No.
that
The thing is that in painted cage,
if you're keeping the
if you're
bird in a
keeping the bird
painted
in a
cage, there
painted
won't
cage,
be any
there
lead
won't be any
poisoning.
lead poisoning.
But if
But
you
if
keep
you keep
the
the
bird
bird in a
newly
newly
painted
painted
cage
cage,
and
and
if
if
bird
bird
starts
start
pecking the
pecking the
paint,
paints,
in
in
that
that
case
case,
the
the
paint
paint
will
will
go
go
inside
inside
their
their
stomach
stomach
or
or
GI
GI
tract.
tract.
This
This
pain,
pain,
the
the
major
major
thing
thing
is
is
that
that
lead.
lead.
You
You
are
are getting
getting an
an.
I
I
got
got
personally
personally
got
got
two
two
three
three
cases
cases
of
of
lead
lead
poisoning
poisoning in
in
my
my
clinic.
clinic.
So there
There
will
will
be
be
a
a
neurological
neurological
sign
sign
and
and
the
the
bleeding
bleeding
will
will
be
be
there.
there. Okay.
Okay. Then how to control fly population in pet birds? That is a basic question and very good question. The thing is that usually, especially this rainy season and all, it's a highly fly populated time. So you can use externally like fipronil spray and all those things. But personally, I suggest covering their cage net with the fly-proofed nets. Fly-proof nets can be used for doing that. That will be okay. Sir, can you tell us about different courses offered in India to study avian medicine? Okay. Courses is that Kerala Veterinary and Animal Sciences University, KVASU, is giving a PG diploma course. That is a distant education with a 15 days contract. I think it's a 15 days contract courses on pet bird and the exotic and pet bird management. You can apply through the, you can go to KVASU, Kerala Veterinary and Animal Sciences University official website, and you can register for that. Okay. Best and safe painkiller for birds. I personally use meloxicam. Meloxicam is a very safest oral painkiller. You can use it in bird, but as much as possible, the pain tolerance in birds are very much higher than that of animals. So try to avoid the painkillers in birds, because in crop there is a crop microbes are there which help to utilize their food contents. So what happens is that whenever you are giving any painkiller, any NSAID or steroid, it will first kill the microbes in the crop. So that whenever you are giving any antibiotics or painkiller, you have to supply probiotic along with that. That is an important thing. But most safest and well good tolerated one is meloxicam we personally use. Even flunicin injection, if you're going for, you can go for flunicin regularly. Any treatment for lead poisoning and how to get about that? Yeah, lead poisoning, the major thing is that diagnose. How to diagnose is that from the symptoms only. From the history and symptoms. History, they will have the access to the paint or lead particles. Second one is that from the symptoms will be having neurological symptom, and also I have already told the urate color, the dropping urine color will be red in color. That you can see that it's a lead poisoning. And you have taken X-ray. If you take an X-ray, you know lead is radio opaque. So whenever you take X-ray, you will get radio particles in the GI tract, so that it will be confirmed. The only thing is that symptomatic treatment only there. So if it is having acute lead poisoning, you can't do anything, the bird will die. Only thing is that you can give some food softener, laxative to flush off it. Or if you see a big pieces of lead in the gizzard and all, you have to go for coelotomy. That means opening the body cavity, and you have to go for proventriculectomy, cutting the proventricle and taking this thing from the gizzard and closing it, surgical correction. Okay. Sorry. Aspergillus fungus infection happening due to sunflower seed. Yeah. It can happen. Not due to sunflower seed. If the seed is being infected with fungal, that means if you are seeing any fungal infection in the seed, that means if the seed is kept open and access to the water due to the moisture, that the fungus will develop. Even the most problematic part with the fungal infection is that even though you keep in the sunlight or cook it also, the aspergillus toxins will die. That will affect the liver. So whenever you are seeing aspergillus infection or fungal infection in the old sunflower seed, better to discard that. Don't use it for the bird. Okay. So you can even go for antifungal medications if you are seeing mild cases. Best antibiotic for birds, site for injection. So many antibiotics are there, cephalosporin, depending on the condition, what condition you are giving, enterococci, ceftriaxone, sulfur trimethoprim, any antibiotics can be used. Site for injection in birds, I will tell in next class. There are different sites are there, subcutaneous sites are there, intramuscular, IV, how to give IV in birds, how to go for intraosseous in birds, how to go for intraperitoneal in birds. These are the different injection sites. I will just show you with the diagrams and the figures in my next class. Thank you. Which purgative are normally you can use for birds? Yeah, purgative or laxative. What we are commonly used is Dufalac. Dufalac can be used, or simple paraffin can be used. These are the two common laxative I'm going for the birds. I think hope I'm clear, Dr. Meena. I think that much only is there, the questions here. So sorry, when will be the next webinar? That will be announced by Cellpet, Mr. Uh, uh, Cellpet people. They will tell you when it will be the next. Mostly it will be in coming
Mostly
week.
it will
I
be
think I
done
don't want to
next.
uh, lose in touch. Means I want you to continue with means in the freshman within 1 week we will go for it. Okay. Thank you, doctor. Thank you, doctor. Okay, okay. Thank you all. Thank you all for the patient hearing. Thank you, Dr.
Thank
Arun
you, sir.
Meena. Yeah, he is my colleague. Hi, Arun. Um, I will share my experience with Cellpet in my next presentation. Sure, Dr. Prabhakaran. Yeah.
Yes.
Thank you. Thank you all. Thank you so much. Uh,
Thank you, sir. Thank you, doctor, sir. Thank you so much. For, and all the participants, thank you so much for keeping so much of patience. So, doctor, sir,
yes.
sir, wish you the best, sir. And we'll keeping the second webinar that's in continuation on the treatment on birds. So we will be announcing the date soon, sir. All right?
Yeah, yeah.
Yes. Okay. Bye.